name is Cheeseman. At the moment, I'm not working. I look after my 2 children. I think it probably started, it was at least 6 months before I was diagnosed. And I remember people commenting on the amount of bruises I had. I just thought I just bruise easily as well. But I started to notice them in strange places, like on my wrist or on my hand, which is somewhere where you wouldn't normally bruise. And then I started getting pains in my legs. And I noticed that when I was going out for little runs, only short distances, 5-10k kind of thing, but I noticed I was getting quite a lot of pains. And then things over the next couple of months got really, really bad. I went to the doctors and he said, I'll send you some blood tests. And he actually sent me for blood tests the following day. I went to work, and on the way home from work I was carrying a carrier bag, just a plastic carrier bag, and I was on the train and all my hands, where I'd just carried this plastic bag, it wasn't heavy, was coming up in bruises, and if I did that, I'd bruise. That was the moment that I knew something was seriously wrong. I got home and there was a message from the doctor saying go straight to the A&E. The consultant and his assistant, another doctor, came in and told me it was aplastic anemia. And they said, the good news is it's not cancer, but it's aplastic anemia. And you go, oh, great, anemia, no problem. And then the more he taught and told you more about it, the more upset you get. And I remember thinking, God, do you want me to cry? When I was in the hospital and I had the Hickman line in, I really, really hated it. Some patients like it because they don't like needles. I don't mind needles, happy to have needles. It was this horrible big tube of plastic stuck in my chest that would pull, and they're big, they come from here down to here. And I said, when I come out of here, I'm going to design a holder for them. So it took me a few years writing down different ideas. Couldn't get the design right for it. So I did take my time. And then when I went on maternity leave in 2011 with my daughter, I had a lot more time on my hands. And that's when I really got into it and got it launched. I designed the central line holder. I approached a few charities, and Leukaemia CARE were fantastic with me, and they said, yep, we'd love to share your story. So I wrote, with their help, a piece about my story, and they did some photographs and was in their Journey magazine. They've always been really, really, really supportive of me. Really, really great. And I wish I would have looked them up and found them sooner, because I think it would have been fantastic to talk to somebody other than your friends and family who are sick of hearing about it. Speak to people who want to hear you, want to listen to you, and it's, they're not going to judge you. You can say what you want. Absolutely. I wish I would have had that support, just for somebody, even at, in the middle of the night, to phone and moan, because you need it. And don't be afraid to be upset.